Thank you very much. So it's my time to talk about Thailand, which is one of the ASEAN country. And stroke is the number one cause of mortality among male and female in Thailand. As you can see, we have a lot of stroke patients there. And also it's the cause of major disability, especially in female. It ranks the second in male, but total number is very high. So as you know that stroke is the number one mortality and probably number one disability throughout many countries, also in Thailand. Strategies to helping stroke in our country started many years back. Actually, we started our first IV thrombolysis in 1996. That was our first case in our hospital. And then later on, other hospitals developed what we call stroke fast track program. And we got a very good collaboration with the Ministry of Health to enhance the number of hospitals that can give IV thrombolysis. And we had our Stroke Society in 1999, and then we had started to have our first stroke unit a long time ago. And then there are more numbers of stroke unit, and there are more right now because of the work of the Ministry of Health. Also, the payers agreed to pay for the IV thrombolysis in 2008, and then we now have the accreditation program for our stroke cases. And it's mainly due to the work of the Ministry of Health and other people that help with the accreditation program. And also we have the public awareness and campaigns for patients and public to know about stroke. And that happens for many years back. So this is our first paper showing that thrombolysis can be done in our country, and that was a long time ago. And then after that, the Ministry of Health kindly accepted the advantage of treatment, and the treatment is now available throughout the country. So in Thailand, all the provinces, we have 77 provinces, all of them can have at least one hospital who can give IV thrombolysis. And it can be given by either neurologists, neurosurgeons, or even general practitioners who are already trained, and ER physicians. So after the Ministry of Health and the payer for the health care, they agreed to pay for IV thrombolysis. The rate of thrombolysis was getting higher after 2008 here, and also with the stroke network that has been established in the whole country, the IV thrombolysis rate is now up to 5% of all the stroke cases who presented to the hospital. So not only the advanced hospital, this is for the whole country. And now in Bangkok, we are having our stroke network. Actually, it's part of the service plan of the Ministry of Health, and we divided Bangkok into 8 parts. And actually, there are 8 hubs and different spoke hospitals. And these are actually not due to the distance between the hospital and the spokes, between the hubs and the spokes. Actually, it depends on the spoke that want to be part of each hospital. So for our hospital, for example, we are having spoke which can be as far as very long distance here, maybe about almost an hour to come to our hospital, but we are using telestroke network to help us to do the consultation with these hospitals. And we are going to publish our data on the drip and chip program, and comparing with the chip and drip, what we call, and also mothership program. And we found that drip and chip program helps a lot in terms of helping people to get IV thrombolysis earlier and then be transferred for another investigation and management. And now the rate of IV thrombolysis in Bangkok, it was low before. With the stroke network, we have this higher number of IV thrombolysis in the total stroke patients in Bangkok. And now we are also doing teleconsultation with Laos people, and we just published our first paper with Laotian colleagues that we actually give some advice for IV thrombolysis in Laos, and there are the first 10 cases of patients who received thrombolysis in Laos. So, and also we are moving on for the thrombectomy. Now we have centers for thrombectomy in different parts of Thailand in each area, but not as many as we wish, but we are moving forward to that. And the Ministry of Health is very keen on doing this accreditation program, and they actually trained and accredited many hospitals for the stroke unit. And now we are having around 100 stroke units throughout the country, and it's distributed in many parts of Thailand. And we also trained the EMS and with the network training. We're trying to help them also, and we are having this World Stroke Day campaign, which has been going on for more than 10 years. And you can't read this, but this is in Thai, and it's actually happening today in Bangkok. Then we are having the World Stroke Day public by the Thai Stroke Society. And when the angel comes, we actually very appreciate that we get more help from other people. And we have a group that is going to be, it was a Thailand Angels Committee, which consists of many people from the government part, from the universities, and from the other part of the neurologists from Thailand. And with this angel program, they actually provide toolkits. As you all know, that this is used in many trainings and in some centers. We also have facilitating the training process, and we also have some applications that we've been using for transferring patients from our spoke centers, spoke hospitals, and this is the one that they would use and send the information before they send patients to us and before we do the teleconsultation. And we are developing now mobile stroke app for the EMS. And this is going to be, it's written in Thai, you can't read it, but it's face-arm speech, and we want to differentiate between large vessel occlusion and small vessel. And I did it in here last night, so it's in Manila. We have the map of Bangkok that we should, the EMS would be able to know which hospital that they're going to send to, and the timing between the place to the hospital. Would that be sufficient to be in the window for thrombolysis or thrombectomy or not? All right, we have a lot of reviewing current process. Angels help us to do the video monitoring of our process, and this is part of our video monitoring that the resident would get called the ER physicians, and then we the patients will be transferred, and we can review the process, and that helps us a lot to improve our care in the hospital. Also, they provide a lot of trainings. We have case simulation workshops in many places, and we also do body interact workshop and NIH training, and also Angels simulation workshop happens in many hospitals throughout Thailand, like here. All right, and we also did telemedicine workshop for our hospital because we are doing a lot of teleconsultation, so this is one of them. And we're going to host the workshop for the ASEAN countries in the very near future in our hospital, that we're going to have this preceptorship workshop for other countries around Southeast Asia. And also we are doing some consultations, as I said before, and we're doing consultation between other hospitals, from other hospitals, and also we get consultation from Laos too. And also we do Angels Award, like here in like the ESO. And before we register our patients into the governmental, the MOPH, the Ministry of Health registry. And now it's transferring part of it to rescue, so we can be in line with the standard rescue program. And there are many hospitals who are actually registered to the rescue program. And we actually had our Thailand Angels awarded just recently. This is the second one. So this is in 2019, and we are giving out the awards to the best hospitals and the hospitals that reach the criteria. So we had the Angels Award for 2 years already, and we're going to hope for the near future that we're going to have more awardees. So to summarize, the mortality of stroke in Thailand is now decreasing with the help of many sectors, including the Ministry of Health, the academic centers, and also the Angels Initiative is helping us to improve our stroke care. This is the goal for our stroke care, which is from the Ministry of Health. The overall mortality should be less than 7%. Now we are reaching 8.22%. But for individual mortality in hemorrhagic and ischemic stroke, it's reaching the goal, but still we need to do more to decrease the overall mortality of stroke. So thank you very much.